Tammy's off camera, but she's here in person. Aren't you, Tammy?
Yeah, I am here in person.
We're fixing to go do yard work, and neither of us are looking very pretty today, so here we go. John Apilado. Oh, big thanks. We have 2-week-old Shih Tzu that had the same problem. We're talking about swimmer syndrome. Only in 4 days the back legs are fixed. There you go. It's so quick. Yeah, it's the way to get it done. You got leg problems. You've got flat chests. Whatever it is, tape them up, and you will. If you get it early, it gets sorted out quickly. Lady Rojas. Mama is excessive licking 1-week-old puppies and irritating their bottoms. How much do I guide the mama?
That's nerves.
Yeah, how much do I guide mama not to lick them too much? I mean, there's no way around this, is there?
No, if she's a new mama or a nervous mama, if you don't have her cage covered up like a bird cage, it just comforts her a little bit more when you have the whole cage covered up. If these are newborn babies and they're about a week old.
They're a week old. Just also, how do I care for their bottoms? I feel like this is affecting their bathroom time. So
I would cover up her cage, make her feel real comfortable and secure. Something's making her real nervous. Just being a first-time mama.
And
so
Neosporin on their bottoms is the thing. There's really, other than what Tammy said, I don't think you can't stop her from doing it.
No.
But yeah, Leechy's been a good mom.
But if you're in there with her in the same area and you hear her start to lick them, just tell her no, and take the baby away from her and move the baby over. She'll eventually learn.
John Calhoun's got 4 questions here, so I'm going to lump them all together. So he's asking about, chances of getting a large litter, and he starts talking about doing an AI on 10 to 12. Can I get a large litter? So.
Timing.
Yes, right. So it is.
Timing.
So the things that make for a largest litter you can is, number 1, you're under control of the mum. How many eggs does she produce? You want to fertilize all the eggs at the right time. That's timing. And you want to have quality semen used the right way. That's technique. And that's also how the semen is shipped.
And how you get the timing is the progesterone machine.
That's right.
We sell that on our website, mybreedersupply.com. That progesterone machine definitely is worth the money for your timing.
For us, have one puppy
on breeding and timing on having babies.
C-section as well.
And then people come to you to get tests done, so you can make money back on it. It's something that you can buy and make money on.
But back to numbers. This is what I like to do. Depending on the machine, it varies. But we'll talk about IDEX because that's what most of the vets have. I like to do the first vaginal AI on the 15. And then if you're going to do another one, do one 2 days later, especially if that's going to be a TCI. So a TCI or a surgical, normally the numbers on that are something around a 25 to a 35. So on a fine care, you can bump those numbers up a little bit. On a fine care, I like the first one on a 17, and then second one 2 days later. And if I'm doing a TCI or a surgical, then about a 30 on that. So, but it's all about that. You ask, how can you order the Shipmate canisters? You can go to mybreedersupply.com. www.mybreedersupply.com and order them right there.
Get ready for a big bump and shake. We're on a rough road.
There it goes. Chris Ennis, can ivermectin injection be given to dogs orally for heartworm prevention? You bet it can. So ivermectin is quite useful for a number of things. It is a cattle, it's used in cattle for things like botfly, but it is very effective as a heartworm medication, and it's also very effective for things like red mange and scabies too. You use high dosages for that, and I'm not going to give you the dosages for 2 reasons. One is I don't want the liability of you getting it wrong
and you're not a vet,
and I'm not a vet, exactly. But you don't give it injection, you give it orally.
Google it.
And to Google what the dosage is, but it's a different dosage for heartworming than it is for these other things. But it is very effective, and it's it's very, you get a little bitty bottle. I don't know what a bottle is now, $60-70, but it goes an awful long way. You hardly use any of it. And one of the things is a little bit difficult to get the right amount of it. So because you do such small amounts, so what I do is I mix it up with some Coca-Cola, and then dish it out that way, and you can make it a larger volume that you're working with. Stupid funny, I have a question. How do you breeders have so many dogs when most states limit 4 animals per household? What type of licenses are needed? Are they difficult to get? Well, we've got 2 females in our house, so we don't have a lot. There are rules and regulations, and it does vary by state. In Oklahoma, you can have up to 10 intact females and as many males as you want. After that, then you get USDA licensing.
Well, that's in Oklahoma.
That's in Oklahoma, yes.
Yes.
But the USDA is going to be
different states, different
well,
rules.
USDA is everywhere.
Oh, okay.
But there are rules, and how many puppies can you have? How many dogs can you have in your house? That varies by city. There'll be a city ordinance that says how many you can have, and that probably has got nothing to do with they're intact or not. The USDA is different. They say how many intact females. I used to think it was 6 or less, but apparently it's 10 or less. And then males,
Intact means not fixed. Able to have babies.
Means breedable. Yes, right. And anything under 6 months old, I don't think counts either. I think you can have as many puppies as you want under 6 months old. But again, we're way underneath this, so it's just not an issue for us at all. So you don't have to worry about it. You can do 2 things. You can you can have voluntary USDA inspections, which is not a bad thing to do. And then if you are AKC and you do enough of this, the AKC is going to do inspections too.
I think it's 3 litters a year, over 3 litters a year. I think AKC comes and inspects.
That could be, I don't know.
I think that's...
We get an AKC inspection every now and then, about once every 8 years maybe.
Yep, and everybody always holds their breath, and it's fine. It's
and
good.
I've done a video on actually the process that we went through.
And they're super nice people when they do come and check you, because they watch you working. They watch you because you're
on your
paying them
side.
money.
They're on your side.
Yeah.
The USDA is a bit different. The USDA is there to find problems.
Yes.
That doesn't mean that they're problematic people,
No,
but they're paid to find problems.
No.
The AKC is paid to make you you have healthy dogs and help you do that. So it's
they're very nice people too. They're very nice.
Yes.
Listen and open-minded. That's what counts.
Yep. Susan Brocksmith, I could be incorrect, but a mated female that is pregnant could have more complications on the spay due to increase of blood supply in the horns.
Yeah.
Well, look, I mean, we're back to this. Don't spay a dog when it's been a C-section. Don't do it. Don't do it. The reason that you're going to think about doing it is because you've got one surgery, and typically it doesn't cost a lot more for them to remove the uterus after remove the puppies. That's the argument.
Yeah.
The downside to this is just like Susan's saying, there are complications for this that could cause the female to be sick, not want to look after puppies, not have any milk.
Right.
So,
and then you're stuck with, if you have 7 puppies born and she's been fixed and her milk goes away, guess who gets to feed them?
That's right.
You do. Unless you got another female that'll accept them in that's got a litter, but man, that's a load on the other mama. So just wait. It's worth the wait.
So Jane Doe, I have a very old, large male cane corso. He has hip dysplasia and he seems sensitive in his ears. He's 16 years old. And I know he has little life left, but I need something to help him with the pain and the hip dysplasia. Yeah, I've got a suggestion. Any suggestion? What's your suggestion?
CBD.
That's right. CBD.
I mean, it'll help him with the pain.
CBD. Give him some CBD daily.
You'll see a world of difference in that dog.
Try it and see. But I mean, it really does magics. I mean, sometimes, not always. I mean, it's not magic, but I mean,
There's some treats that have that in that. That's getting worse now. Can I get through there?
Yeah, I think so. It's pretty narrow, isn't it? But yeah, so there you go. Do you have any litters available? Yeah, we'll have a litter available in another.
Well, I've got two babies that are fluffy carriers that will make lilac and tans, blue and tans, chocolate and tans, and platinums. Fluffy carriers and full fluffies and fluffy carriers. So please give me a call, 580-799-1910. Cody has them too. His phone number, 806-664-0173 is his number.
I have a blue fawn pied. I want to create some tri-Frenches. What should I breed it to? Well, I mean, if you've got a blue, you're fine. You're fine. You can go right through. If you've got a blue fawn, then that dog, with what you've given me here, that dog can't produce 10 points or those kind of things. So, but I mean, it goes back to the same thing. What should you be doing? You should be breeding to a dog that's got great structure with as much DNA as you can afford to pay for. That's it.
Your guy in a pickup's going to have trouble going through it.
Hi James, Tammy. Do you test your stud semen? Yes, we do. Can you explain how you do that? Yes, I will. I'm going to do a whole video on this and how you have to have a microscope, or you've got to go to a vet who has a machine to analyze it. Because taking it to somebody who has an analyzer is the easiest way, but it costs you money. But you can actually do this yourself. And I've got some techniques that I've used over the years that really make it fairly easy. And I'm not going to go into it here. I'm going to do a whole video on that.
You parking my way. You did.
And here's the last one. Well, I think I already answered that one. And we are 11 minutes into this, so we're going to say adios. Thanks for watching the video. I really appreciate people who subscribe to me. It helps me, encourage me to do more of these videos. But do remember, disclaimer here, I am not a vet. I'm not a licensed medical professional. I'm purely a person who's been breeding dogs for the last couple of decades. Any information that you got from this video, use at your own risk. There's nothing implied here, and certainly this should not be used as a substitute for advice from your veterinarian or your medical professional. I hope you enjoyed the video. Come back for more of them. Bye.